Good afternoon, everyone. Thanks for joining us. My name is Michael Woodward, and I am the Trans Community Health Manager at Borrego Health, which is one of California's largest federally qualified health centers. I have a couple of great folks here we're going to introduce in just a moment. Today's event is sponsored by Traction and the Gender Justice League. So let me tell you a little bit about those organizations before we get started, just so you'll know who's coming at you and who's behind this. So Traction is short for Trans Community Action. Founded in 2019, Traction is a trans-led 501c3 nonprofit organization in Washington State. Our mission is to cultivate connection and visibility for transgender and gender non-binary people through community service in support of underserved communities. I'll also say that I'm one of the founders. I'm the co-chair and vice president of Traction, just for full disclosure. What that means is that we recognize that there needs to be a societal shift in how trans and gender diverse people are seen and understood in the world. We believe that the best way to create change is to not just be visible, but to show up, to demonstrate our humanity by working together with our cisgender allies through community service projects, building relationships and collaborative partnerships along the way that lift up the most vulnerable among us. We're here to bring together our community in celebration of, or we're also here to bring together our community in celebration of our beautiful and authentic selves as trans and gender diverse people, and to celebrate a sense of belonging. Our Emerge 2020 and 2021 virtual series features the words and performance art of our diverse and talented communities. And we're also bringing you a multitude of forums such as the one today. I welcome you to join Traction. All you have to do to become a member is to join our mailing list. To learn more or to make a donation, please visit our website at tractionpnw.org. The Gender Justice League is a Washington State gender and sexuality civil and human rights organization headquartered in Washington, Seattle, Washington. In 2012, JGL was started by a group of longtime trans, queer, and allied activists who were looking to increase the community's capacity to address cissexism, transphobia, transmisogyny, and homo, bi, and queer phobias that trans and gender diverse people face. Gender Justice League is focused on elevating civil and human rights for trans and gender diverse people by creating community through advocacy efforts and shared leadership development. Recognizing that only 4% of employees in the major LGBTQ organizations are trans-identified, and that trans people face nearly double the unemployment rate of cisgender people, JGL is situated in a gender justice model that seeks to empower trans people to combat the structural oppression, discrimination, and violence that we face in our everyday lives. To learn more about Gender Justice League or to make a donation, please visit genderjusticeleague.org. So Gender Justice League and Traction are proud to co-create this space for trans community members to ask questions and receive informed answers about what we need to know about the COVID vaccines. And I want to note that when we say trans, we're really talking about anyone and everyone who does not identify as cisgender, regardless of your individual gender journey. So to get started, let's talk a little bit about why we felt this forum was important. As trans folks, we're very aware that the healthcare system has not always been our friend. 1 out of 5 people have been flat out rejected by healthcare providers, even for simple things like the flu or a broken arm. We've been ridiculed, embarrassed, and even assaulted by those who are sworn to do no harm. Because of systemic discrimination, we face almost immeasurable barriers to care. We're also less likely to be employed, to have good health insurance, or to even have family support. Trans people have been repeatedly abused and traumatized, even by those who think they're doing the right thing. And if you're a trans person of color with a disability or other intersecting issues, these disparities are exponentially worse. So trust is a big issue for us. Traction and JGL wanted to give our community the opportunity to dispel some myths and get the facts about the COVID-19 vaccines. So I invited 2 of my favorite providers, both of whom have decades of experience providing care to our people. Before I introduce them, I want to introduce Jasmine and Lauren, who will be our ASL interpreters today. Thank you both for being here. So let me introduce to you first, Dr. Linda Gromko. Dr. Gromko is a board-certified family physician and founder of Seattle's Queen Anne Medical Associates, initially focusing on women's health and obstetrics. I think that's the right word. The practice added transgender focus in 1998. That's the same year I transitioned. Wow, that's a long time. When a prospective client asked her if she treated transgender women, Dr. Gromko said, "Not yet." She now treats transgender people from all ages, age 5 through 85. In addition to hormone management and perioperative trans care, Dr. Gromko is also a frequent speaker for professional groups. She wrote Where's My Book? A Guide for Transgender and Gender Nonconforming Youth, Their Parents, and Everyone Else, as well as her latest offering, which is a practical guide for transgender and gender nonconforming adults. And Dr. Patric Schine, Patric Schine, DNP, FNP, is the medical director of the Department of Transgender Medicine at Borrego Health, California's largest federally qualified health center. Dr. Schine has been working in the LGBT community for more than 20 years with a focus on transgender medicine for the last 14. While in private practice in Phoenix, he served the largest transgender patient population in the state, with services including a free monthly clinic for those patients who couldn't afford office visits. Among his many scholarly activities, Dr. Schine developed Trans 101 for providers, a lecture on medical transgender care, as an introduction to medical care for those who identify as transgender. He has lectured across the country, providing trans-competent recommendations to staff at major organizations that include VIV Healthcare. Patric earned his master's in nursing and family nurse practice, master's of nursing / family nurse practitioner degree from the University of Phoenix in 2002, and completed his doctor of nursing practice at Arizona State University in 2010, focusing on education about and treatment of sexually transmitted infections. He has been faculty with Brandman University in Irvine for 6 years, most recently serving as director of Family Nurse Practitioner Program in the Maribel and S. Paul Musco School of Nursing and Health Professions. When not providing medical care or teaching, Patric enjoys spending time with his husband and his adorable young twin daughters as they help their children develop into a new generation of people who will love and live without the needs to label others. So all that said, Dr. Gromko, why don't we start with you? I'm trying to get back to my screen here so I can see you. Tell us a little bit about what we know about COVID in general, and how it affects or doesn't affect people.
Sure. Thank you, Michael. Thanks for inviting me to this too. This is really nice, and I'm very happy to be here. I am no expert. I want to start out with that this is not intended to be like, I'm not Dr. Fauci, as Michael said earlier, and I think that that's just fine. I'm a family doctor, and I consider myself one of the folks in the trenches, although certainly not treating people who are terminally ill with COVID, but we've had lots of questions and lots of involvement in it this past year. We also, by the way, in my clinic, we have an aesthetic division. We probably remove more hair from people than anybody in the area because we do preoperative hair removal, for example, by laser and by electrolysis. And this kind of thing has really changed a bit because of the fact that we've had some COVID considerations to make. But let's go back and just tell a little bit about COVID itself. I had a wonderful breakfast this morning with a really good friend of mine who happens to be a physician who runs the hotline for COVID for a major corporation all over the country. So she was helping me to learn some things about the infection and the kinds of questions that she's being asked. And she gave me Donald Trump's regimen for treatment, which I thought was fascinating because I can guarantee you that none of us would probably be getting that type of a regimen. But anyway, let's go on. So way back I think it was in about January or February, we started to hear about this viral infection called COVID-19. It's a novel virus. It is related to the SARS virus and the Middle Eastern respiratory failure virus as well. So that's SARS and MERS. And all of these are specifically respiratory viruses that are spread by droplets. droplets, okay? And that's something that's very important because that impacts their contagion and how easy it is to get them, okay? So when you have a droplet spread infection, it's like the droplets that we convey from speaking, especially from events like, I think you've probably all heard about an event where people were singing and almost all of the people in the choir came down with a very acute form of the virus. So anything that's like singing or shouting, so sporting events and all of these things where people are in close quarters and are projecting with volume is a place where you're spreading your droplets. I also learned today that that you can have viruses that live in the air for minutes. You can see viruses that will live on surfaces like cardboard and fabric and that kind of thing for a period of hours, and even on metal surfaces for a period of about 4 or 5 days, okay? So these are the challenges that everybody's facing in how this virus is conveyed. So let me tell you about the viral symptoms. First of all, because it is a respiratory virus, people would often get the first symptoms as being a pharyngitis, a sore throat, maybe a cough. In my experience in my own clinic, we would see the cough being either a very dry cough or the cough being a very wet cough. And I had several of my patients, without any prompting, referred to the kind of phlegm that they were putting up as rubber cement, okay? I know, very tenacious, very awful, very difficult. And that rubber cement mucus prompted a number of ER calls for patients, and not only that, but also Medic 1 calls. Other things that are fairly characteristic of the virus include the loss of smell and taste, which is certainly disconcerting, sore throat, cough, as I mentioned. I just learned the other day that about 30% of people with COVID-19 get GI symptoms of some sort. So there's a lot of things that can happen with this virus that we're learning as we go. Heart rhythms can change with under the influence of the COVID virus. And in my practice, I can tell you over the last year, we have seen so much in the way of anxiety and in the way of depression. And I think that we saw a little lift of it when the election came, and thankfully, I should put my politics out. I'm sure it's a big surprise to everybody that I was really relieved that Trump was not reelected. Anyway, but from there on, I think that things have perhaps gotten a little bit better, but I will tell you that anxiety and depression has been enormous. And I think that that's a part of it. There are people who have long lasting effects. For example, there are people who have what are called the long haul symptoms. You know, people will have symptoms for months afterwards. We don't even know how many months. In the acute disease, you are seeing not only respiratory failure, respiratory difficulty, you see also clotting problems. We know that this virus launches out an intense that's an immune storm. Okay, it's like the body is reacting so strongly against this virus that what happens is that all of the bodily systems that are there to fight infections are in full force. And so you see not only the inflammatory changes, you're also seeing coagulation changes. And my good friend who is the phone answerer for the COVID hotline was saying that people are developing massive strokes, massive heart attacks because of the coagulation effect. So it's very interesting to see what's happening. And I don't think there's a day that goes by that we are learning a little bit more, another tidbit of something that's happening with COVID-19. And I'm sure that Patrick and I are going to get into this later in terms of what are the things that we want to look for. But I should probably just stop talking for a while and let somebody else join the discussion here. So I'll back off.
Thank you for all that. That's really helpful, because I know we hear lots of different things and everybody has their own stories about what they've experienced. Dr. Schine, can you tell us a little bit about the vaccine itself and maybe the differences between the vaccines and how they're developed, and is it going to make us sick and all that?
Absolutely. And thanks, Michael, for having us. And like Dr. Gromko, I am not Dr. Fauci. And so, again, this is informational, and this is really what we're doing in the trenches. So this is stuff that we know, and I'm not a biochemist, so I'm not sure. But I can tell you certainly some of the basics. So the first vaccines to be released were the messenger RNA, the mRNA vaccines from Pfizer and Moderna. I believe Pfizer got the first release of it, Moderna came second, or it could be vice versa.
I think you're right.
Yep. And so these vaccines were new to us as well, as far as what we're doing with it. They've been used before, I believe, in a vaccine. Oh gosh, now I forgot the name of the disease state. But it's been used before, just not in this way and not for this virus, of course. And so when they came out with their studies, and again, there was a big push late last year to, we need this vaccine, we need to get some kind of treatment or prevention measures for this. There was a big push to have these done. And so I think that scared a lot of people, because it does normally take months to years to develop vaccines before they're released to the market, even under extreme circumstances. And so there was a lot of misinformation going around. So these vaccines work, the mRNAs work by going into your RNA, they're a messenger, and they tell your immune system, hey, here's it's called a spike protein. Here's a spike protein of what COVID-19 is. I want you to make this, so should you see it again, you know what to do. And so our immune system does what it does. It sees it, it makes it, and then when it comes in contact with it again, our bodies are ready to fight off and prevent that infection, or at least prevent that infection from becoming serious. And so, well, with these vaccines, there were some caveats with it. The Pfizer vaccine has to be at suboptimal or sub-freezing temperatures, so there are special refrigerators for that. And the Moderna vaccine has to be frozen, so from my understanding. So there are some storage and availability issues with that, and so places had to make sure that they had the right freezers and containers for it. And this new one that came out from Johnson & Johnson is one that is a 1-dose vaccine, where the others were 2-dose. So the Pfizer vaccine was shot at initial appointment, and then 3 weeks later you got your second shot, 3 weeks or later. And then the Moderna was 1 shot at initial appointment, and then a month later you would get your second vaccine. And there were varying stories about side effects from these. Most people had a little bit of sore arm with both the Moderna and the Pfizer, and on the first shot. So a sore arm for about 2 or 3 days, and we're kind of used to that. I mean, if you've had a tetanus shot, that one kind of hurts a little bit more, so you kind of feel that for a couple of days. The second shot, people were reporting symptoms kind of all over the place, and different things. So there was, the only thing that was kind of similar was your reaction to some flu-like symptoms, and not everybody had reactions to the second vaccine as well. So everyone's immune system was a little different. And then, of course, recently we've got the Johnson & Johnson vaccine out, which is a single dose, and that's made a little bit differently. That's made with a strand of something called an adenovirus. And so it's a 1-shot virus. There are definite concerns about that one, because you hear about Moderna and Pfizer being 94, 95% effective, and you hear about the 85 and the 68% effective with the Johnson & Johnson. You think that doesn't sound right. Of course, I want the 2-shot regimen. But when looking across the board at keeping people out of the hospital with moderate or severe illness, they all worked. There was no hospitalizations from anybody who got the vaccine for severe COVID or moderate COVID infections. So we know these vaccines are working, and there's other vaccines in the pipeline as well.
Okay, great. Thank you.
We might add to that as well, Patrick. I think that the point that we need to keep in mind is that the purpose of this vaccine, as I understand it, correct me if I'm wrong, but is not to prevent a person from getting the virus entirely. It's from getting really sick with the virus. Okay. And the symptoms are so awful. I mean, when people get really ill, they get sick, and they get sick so fast. And conventional things to support a person in respiratory failure simply do not work. And so I think that there was a great impetus to get the vaccine out too, because it was so awful. The infection
Right.
was so bad.
Well, and that, with that being said too, there's still some concern about, will this prevent asymptomatic carriers? So, and we don't know that yet. So we really are not sure what that's going to do. But I think the buzz over the Johnson & Johnson single-dose vaccine is, again, that can be refrigerated. It does not need to be frozen. It can hit those more rural areas much quicker, and can be dispensed much easier than the other 2 vaccines. So there's a lot of hope that one will get most people inoculated faster.
So is it possible to choose which vaccine you get?
Here in California, not always. So if a clinic has the vaccines, you could choose which ones you want. However, most of the public health departments are saying, you're going to get the Moderna, you're going to get the Pfizer, and you're going to get the Johnson & Johnson. But if a clinic does have them, then yes. But let's say you go into a clinic and they have one of Pfizer and Moderna, you have to choose which one of those you want. because you can't get the Moderna vaccine and then get your second vaccine as a Pfizer. It has to stay within that same manufacturer for those.
Yeah, that's really important. I think I see one advantage to the Johnson & Johnson one, especially since it's one dose. It's so much easier for rural populations and folks that have transportation issues to just get the one shot and be done, and not have to worry about it. And I think, the main difference between the other two really seems to be as far as the way it has to be stored. The Pfizer one has to be in a deep freeze. And a lot of clinics, like even Borrego, which has many clinics all over Southern California, we don't have one of those big heavy duty deep freezers. So we're pretty much sticking with Moderna, I believe. But the Johnson & Johnson one, as Dr. Schine said, is perfectly legitimate. And in fact, some people might prefer it because they only have to get one shot.
Right.
So I know there's some concern about allergic reactions. Can you talk about that, either one of you, a little bit?
Sure. Well, I think for many things that are injected into bodies or ingested, et cetera, can provoke allergic reactions in sensitive people. In any clinic where they're giving the vaccine for COVID-19, they will be prepared to face an allergic reaction if it happens. And specifically, what one needs to do is to have the equivalent of an EpiPen available. And an EpiPen is it's very simple to use. You just basically flick off the caps and just plunge it into a muscle, and that works very quickly. But what it does is it gives you a blast of epinephrine, and what epinephrine does is it opens up your airways, it makes your heart beat faster, and it basically gets your body physiologically prepared to run away from a tiger if you need to, okay? So basically it's going to just squash that immune response that you're having, which is giving you the allergic reaction, and then you're able to then breathe again, move again. The hives that you might get are going to be reduced. Some people actually carry EpiPens with them for various reasons.
Mm-hmm. And if they're going to have an allergic reaction, is it going to come on like pretty much right away, or will it be, a few hours later, a few days later?
So for those emergent ones, like Dr. Gromko was talking about, they do happen. So we watch everyone for 15 minutes or 30 minutes if they've had a prior reaction. So if you haven't got the vaccine yet, you expect to spend a little bit of time in the clinic because you will be sitting for a minute while our nurses and other staff watch, just to make sure that you don't have those severe reactions. But we also prep patients because the next day your arm is going to be sore. You might have some of the flu-like symptoms. That's because your body is doing what it's supposed to do. And people get fearful of that, thinking, I've got COVID and now I need to go to emergency room or urgent care or call my provider. And so we really want to be intent about telling folks this is what's going to happen. Don't be afraid. These are the serious things that you need to look for.
Okay.
We had a lot of, in my staff, for example, we all got the Moderna vaccine, and the first one, we just kind of slid through it. It was no big deal at all. And then the second one, what happened is that I think to a person, we all got, some sort of not an allergic reaction, but some sort of a response. And like, for example, I rolled over in bed later that night and woke myself up because it hurt. Just my muscles and joints were sore. And most of us had some kind of a profound fatigue and kind of a sort of what we might call a flu-like reaction, something like that. And what we all concluded was that this is better than a ventilator, okay? Because we have a number of high-risk people in our clinic, myself included, because of age and asthma. And so we were concerned that some of us really are at risk for COVID-19. So in my view, a little soreness, better than a ventilator any day of the week. So we'll certainly take that.
Absolutely. Yeah. I think, in my opinion, I mean, I'm just, a trans guy who doesn't know anything, but, I feel like the vaccine is super important for all of us to get. And, because this whole idea of herd immunity, and, we have to get as many people vaccinated as possible so that we can all eventually, go back to enjoying our regular activities and daily lives and going out to eat and, all those things that we hopefully are, going to be able to do again sometime soon. I know California is still pretty deep in the purple and red. San Bernardino County just turned red today. They bumped up one one notch on the, so like some things will be opening up that weren't open before. But Riverside County is still purple. Dr. Gromko, do you know about where things are in Washington as far as the Seattle area and stuff?
Washington's doing pretty well, as I understand it. In fact, I heard that Washington was about like 48th in the country in terms of their infectious disease rate here with COVID.
Nice.
I'm not honestly sure that that's true, so don't quote me, but I think that we've done very well. And in fact, I think that a lot of us do tend to be pretty resentful about that. It's my belief that if the entire country had approached COVID-19 the way that Washington State did, that we would not be having these discussions. We would already have, the virus would be not gone perhaps, but I mean, it would certainly be controlled, and we would not have seen the millions of deaths that we have seen so far. It's just very, very frustrating to see that.
Absolutely. And sad. Yeah.
Mm-hmm.
This is a little sidetrack, but I'm curious about this because this is really more about not about the vaccine, but treatment of the virus itself. And if you're at home and you're having respiratory issues because you have COVID, I've heard that using if you happen to have a CPAP machine, that can help a little bit. Is that true?
I think it probably would be, Michael. I don't have any firsthand knowledge to say that it is, but CPAP is interesting. I love the concept of CPAP. I mean, it seems onerous to wear and to use and all of that, but boy, the people who have it love it and travel with it and everything. But CPAP stands for continuous positive airway pressure. And what that means is that remember that you always think in terms of what's the bottom line of any particular organ, okay? So like the bottom line of what the lungs are going to do is to exchange oxygen and carbon dioxide. So in with the good air and out with the bad air. And so what you need to make that exchange is that you need to have the contact. I can't do this it's terrible. But anyway, you have your alveoli, which are like the little bubbles at the end of your lung tissue, and they are abutted against blood vessels. Okay, so what happens is that the little alveoli stay open, the gas exchanges across the membranes into the bloodstream, delivering oxygen and receiving then CO2 as this gas exchange occurs. So what CPAP does is it allows your alveoli to stay open a little bit longer, and it prolongs the gas exchange time. It's very ingenious, really. It's a really neat idea that somebody came up with. So, I have a patient just recently who was having a lot of respiratory distress at home. This was a quadriplegic gentleman who was at home, no movement whatsoever. And we used a CPAP for him in encouraging his blood oxygenation, and it really worked quite well. He has died, but at the same time, we did get him some relief over that time period. So anyway, I think CPAP might be a good help. We found that one of the things that was helpful in treating people at home, because one of my jobs was to keep people out of the ER, okay, for a couple of reasons. One of the reasons that you want to keep people out of the ER is because you get sick there, for heaven's sakes. And then everybody has COVID there, so you don't want to go to the ER. But the other thing, and this is also very important, is that if you use resources for other things, you don't have them to use for COVID, and vice versa. So one of the things that we would do is we would help people learn when to worry, okay? We would get people calling us, I can't breathe. Well, if you are talking, you are in fact breathing, okay? I mean, if it stops, you're no longer breathing, but if you're talking, you are breathing. We have, and I'm gonna show this little gadget. I don't know if you can see this. If you can see that. This is a pulse oximeter, okay? And every clinic has these, but you can get them on Amazon, and you can buy them in Bartell's. And what happens is that if you put it on your finger, it's going to show you two kind of important values. It's going to show you what your oxygen percentage is, and it's also going to show you what your heart rate is. And we know that with COVID, one of the things that was happening was that people were going very, very low in their oxygen levels, and then all of a sudden would just crash, okay? So if I had somebody, okay, so Linda's at a 99% O2 sat, and my pulse is 71. I'm going to live, so this is great. But if my pulse, for example, was 120 and my oxygen sat was like 58, then I'm in trouble. Okay, so it was an early warning signal that we could use with patients, very cost effective, very easy to use. Okay, so that's one of the things. And then we would try to encourage, I hope I'm on the same train of thought, Michael. I don't know, just steer me back if I'm not.
It's okay. It's all good stuff.
What?
It's all good stuff.
Oh, okay. So anyway, but what we would try to do at home for people was to do the supportive care that you could do. For example, and this I'll go into Donald Trump's regimen, but we know, for example, that if people have a lot of fluids, for example, that's going to help them clear a viral infection. For example, we know, for example, that aspirin, even just regular old aspirin, can help with some of the blood clotting manifestations that come along with COVID-19. That's interesting, I think. When I was sick with a viral infection that I think might have been COVID, but who knows? My tests were negative. But I was taking my vitamin D, I was taking some aspirin, and I was taking some guaifenesin, which is something that helps to clear out mucus in the lungs. So there's a number of things that can be done very informally and probably very helpfully, certainly not hurting.
Great. That's
I want to hear
super,
I want to hear Donald Trump's regimen.
right?
Okay, here you go, Patrick. This is what they did. Okay. Now, one of the manifestations of steroids, okay, which I'm sure Donald Trump did get, is that people can get a little manic. They can get a little bit like pressured speech, rapid speech, that kind of thing. Well, I'm here to tell you that if you watch that tape of Donald Trump on the balcony after his hospitalization, rewind that thing. He was a little hypomanic at that point, and so he certainly was on steroids. But here's the regimen. He had vitamin D. This is very interesting to see that higher dose vitamin D seems to be helpful. And I know that around the country, people are actually doubling a dose of vitamin D that a person might be taking normally. Probably in California, you don't see this as much, but certainly in the Pacific Northwest, nobody is okay with vitamin D levels. We don't have sun. So vitamin D is one thing that seems to help. And in fact, in people who absorb more vitamin D, there is an assumption of some protection. So if you have somebody with a lot of melanin in their skin, for example, people who are darker in their skin color, so Black people, Latinos, for example, may have less protection because of their vitamin D level. So that may be something to look at. Donald Trump got vitamin C and zinc. He got melatonin. COVID does mess with your sleep, but I have no idea what the mechanism might be. He would have gotten aspirin or some kind of an anticoagulation, steroids, glucocorticoids. That's one of our stress hormones. And so if you get a big dose of steroids, for example, that too is going to give you a strong anti-inflammatory response. Many of the COVID symptoms and complications are the result of an inflammatory storm, for example, that a person gets, and it just goes crazy. It's like it's so potent and so strong that if you can oppose that with steroids, that can help. Now, many people in the hospital are going to be getting, and Donald Trump would have gotten antibiotics, not because the antibiotic is going to help a viral infection, it doesn't, but antibiotics help to address the secondary pneumonia, the post-viral pneumonia that many people get. In the hospital, people will get an antiretroviral drug called remdesivir. I know nothing about it except for it exists. Strong glucocorticoids, anticoagulants, and this is, I mentioned before, when people have COVID, many times the cause of death will be pulmonary emboli. You know, we all know who have prescribed hormones for years that we warn people about the effects of for example, of a DVT, okay, or deep vein thromboses. And when we have a clot, a blood clot in your leg, for example, and as you return to the heart, all of the blood vessels get bigger and bigger and bigger. And then finally you move through the heart and into the lungs where they're tiny. And so one of the things that people will get is pulmonary emboli, heart attacks, okay, from obstruction, from vascular obstruction, and also stroke. So those are the things that they're trying to prevent, and they would do that with an anticoagulant. The other thing that Donald Trump would have gotten would be the monoclonal antibody treatment. And these are basically antibodies that are harvested from people who have had COVID, made natural antibodies, and then they are given to an individual. So he basically got everything in the kitchen sink, okay, when he was hospitalized. And I don't think we would, okay, just in fairness, I don't think that that's probably typical treatment. I do know that some of these things are becoming more protocol as people understand what's necessary to treat COVID. And I do know too that the focus of not being on a ventilator is what we often call a respirator, for example, or mechanical ventilation. The advantage of that is that if you have somebody who can't take a full breath and therefore cannot oxygenate, the ventilator will help take that function over. We should also talk, Michael, about the people who are at great risk. Okay,
Sure.
like what people are at greater risk. And I would say that as a family doctor in Seattle, I'm just going to take a look at Donald Trump and say, I bet he's got some risks. He's got some things that put him into a higher risk group as well. So do you want me to keep on this little line or what?
Yeah, I think talking about the risk is pretty important. I mean,
Okay.
people may be aware of them at this point, but there's never too much information around this kind of stuff.
Okay, so the things that people are looking at as being higher risks for COVID or for death with COVID, we should specify, are things like age. So the older you are, the more likely it is that you're going to actually die of COVID, okay? Anybody with a chronic illness, so diabetics particularly are at great risk. People with any kind of underlying pulmonary disease. So that's the person who has asthma or the person who might have an underlying COPD, for example. Smokers are very much higher in their risk with COVID-19 for dying with COVID. Anybody with a chronic pulmonary fibrosis, for example, interstitial lung disease would be at greater risk. The people who are obese, greater risk as well. Oh, hello, somebody said hi, how nice. Anyway, so so there are a lot of people who are, but obesity, diabetes, and any kind of underlying illness are things that are going to topple the system quicker. Okay.
Okay. So I'm not seeing the chat, but I want to just, if people have questions, put them in the chat and we will, well, there's one right there. Okay. But first I wanted to ask Dr. Schine. So I think the biggest question that folks have that are trans, and I noticed, Linda, that you didn't say trans people are more at risk for dying of COVID.
Right.
I guess the only corollary there would be because of our other health disparities, we might be a little bit more at risk because we tend to be, have diabetes at a higher rate and things like that than the general population. But anyway, I just wanted to throw that in there. But Dr. Schine, everybody's curious, how is this going to impact my hormone therapy and my transness with the vaccine?
The vaccines don't impact it at all, as much as we know. Doesn't impact estrogen or testosterone. So it's perfectly safe to get with hormone regimens. Again, the only time that we're looking at stuff of where a vaccine might impact might be some certain chronic illnesses, as well as maybe some certain medications. But right now, getting the vaccine outweighs any of those risks that we know.
And can a allergic reaction cause a heart attack?
Is that for me, I think?
Either one of you.
I think it probably could. Now, we would have to have the right setting, okay? So you'd have somebody who would have a predisposition to cardiovascular disease, for example. It wouldn't be a typical symptom, but remember that you're really, gosh, how can I say this? When somebody has an acute medical crisis, okay, if in an acute medical crisis, everything is going to be aimed at defending your brain, your kidneys, and your heart, okay? So if your system is trying to fight anything, all of those other systems will be at greater risk. So I think it could happen. But remember, one of the things that you often will do is to give epinephrine. So if you're treating it and you're supporting with fluid and that type of thing, you're going to be helping that person as well.
Okay. Okay, so Doctor, go ahead.
And Michael, real quick, one of the things about asking that question about can a heart attack happen from this? Social media is amazing. There's TikToks going around where people are stating that they're having emergency stuff related to vaccines. And, it's hard with all that information out there to kind of sift through what is real and what is for show and what is really happening out there.
Great. So a question we have from the audience is, so what if someone is in the hospital or has just recently had surgery and is still in post-op recovery? Should they still get the vaccine? Are there other times when you shouldn't get the vaccine?
Oh, gosh. I don't think there is a time when you shouldn't get the vaccine. What do you think, Patrick? Do you think?
I think it's the same. If you have the vaccine available, and I just watched a lecture on this, is get it. If it's available to you, just get it done. I mean, outside of having, massive coronary artery surgery or something along those lines, get it. If you're home and recovering and it's for trans surgeries, then I can't think of anything that would keep you from saying I'll hold off, unless you're feeling like crud. Then wait till you feel a little bit better. But if that vaccine is available, then I would say get it.
Yeah, I think also if you've had some other kind of vaccine recently, like a shingles vaccine or even a flu shot, I think they want you to wait a little, don't they?
2 weeks, from my understanding.
I think there's something like that, yeah. We saw a lot of trans surgeries. We do a lot of preoperative and postoperative care in my clinic in Seattle, and we saw a lot of surgeries sort of shelved. Okay, so the gender affirming surgeries were just basically put on hold for a while, and that was very interesting. And of course, now when you go to the hospital for anything, if you go to a clinic for an endoscopy, like a colonoscopy or something like that, they will ask you to test. So you have a test before, and then you kind of quarantine. And I know the folks who are going down for gender affirming surgery are being asked to get a test and then quarantine themselves. Oh, by the way, let me add that I got from my expert friend here, like how long you're supposed to be quarantined. I thought this was really interesting, okay? Because these rules have changed a lot and they change daily. But this is what she said this morning. She said that, so if you have COVID, okay, that 10 days after your symptoms have gone, okay, that you can go back into the world, okay? However, if you have a fever, okay, now a fever is defined in the medical world by 100.5, okay, degrees Fahrenheit. So if you've been more than 24 hours without a fever, if your symptoms are not worsening, okay, and if you are not hospitalized because of severe disease, then you can go back into the world in 10 days, okay? If, on the other hand, you were afflicted with very severe disease, for example, if you were in the ICU, if you were on a ventilator or something like that, that's going to kick you into the severe disease category, and you will be quarantined for 20 days. Okay, is that what you guys have heard too?
Sounds about right.
Yes,
Okay.
and there's also some stuff about folks who maybe had very light symptoms, and they've been fever-free for 7 days, that actually they can come out of quarantine after 7 days. So I think it does vary by state and vary by different counties and things like that.
It's really hard too, because when the information is changing so fast, I mean, and you saw this in the listen to me, the early days of COVID, like a year ago, I mean, it's like, I mean, even Dr. Fauci, well, he didn't recommend a mask at first. Well, of course, that was wrong information, but that's how science works. You learn something and then you change your behaviors and your recommendations according to that. So I think that's one of the things that people can get really derailed by, is the fact that they're told one thing and then next week they're told another thing, and then they start to not trust the information that's out there. The thing that I would just want to restate and to really reemphasize is that any effect from the vaccine that we have seen, okay, and really that comes from other vaccines as well. So any vaccine, that effect, if you have mild side effects, et cetera, that's better than getting COVID, okay? So if you can prevent yourself from getting COVID, but most especially if you can prevent getting a severe case of COVID that winds you up in the ER, the ICU, and particularly on a ventilator, that's a problem, okay? So avoid that at all cost.
Well, and I think it's also important to talk about, like, as we get more vaccinated, we still need to stay vigilant. Right now they're saying, if a group of people under six numbers, not under the age, of six can get together without masks and socialize. For larger groups, you still want to wear masks and stuff. I know that having the vaccine myself and being fully immunized, I do feel relief from it. And I certainly feel like, okay, a little bit better about the outlook on things. So I just am really happy that we're having this conversation and are hoping that people go out there and do what they believe is right for them, which I would think would be vaccination.
Great. Can you bring up that question again, Amy? I think, Patrick, you actually answered the question, one of the questions. Yeah, can you spread the virus right after you get vaccinated? And how long does it take after getting vaccinated to not spread the virus to loved ones?
Well, there's a couple of things on that question. So the question is actually asking about active disease and asking about vaccination, and they're two separate things. So vaccination is you're not, because you get vaccinated, you're not going to spread anything. So you still want to hold off until the manufacturer of the vaccine that you got says that you can. So after the full dose of like the Moderna and Pfizer, so after 3 weeks and 1 month of that, 2 weeks after that, you're supposed to be able to go out into the general public without feeling that. And it's 2 weeks for the Johnson & Johnson vaccine as well. If you're symptomatic, I believe Dr. Gromko did discuss that really well about it. When can you go out to not spread the virus? So two different questions. These vaccines cannot give you the virus.
Correct. But they don't prevent you from getting COVID. You just won't have as severe symptoms.
Correct.
And one thing that I've heard is that, even people with really mild symptoms that may not have even realized they had COVID, there may be health implications for them 5, 10, 20 years from now that we don't even know about. So, this is one more reason that it's really important to take all these precautions, and even if you have gotten the vaccine, you still need to, that was actually my next question. What else do we need to know about the vaccine as far as, what do we do afterwards? And what do we still have to do, social distancing and masking and all that? And why, and, how long, all that.
Well, I think if you listen to what President Biden just said about the 4th of July, so that's a very positive and affirmative way to come out and say, you know what, by the 4th of July, we will be able to celebrate in groups of people. We probably still wear masks. Some people will probably choose to wear them indefinitely, just depending. But looking at July 4th, that's kind of the date that most people will be vaccinated. There will still be some variants out there. People will still be getting sick from it. And there will be new strains and other things coming out. That means there will be new vaccines coming out as well. And so we don't know when we need to get the booster shot for this. They say a year. It could be 6 months. We just don't know yet. So I think it depends on the strains. Like some of the studies, I believe Pfizer was down in South America where they had a really horrible strain. So they were able to have better numbers because they saw some of those variants. And don't quote me on that. I could be getting them mixed up. My little brain right now
it changes every day.
It does, right?
I had when I was in school, in medical school, they said this was a discussion about antibiotics. Okay, so a little different slant. But the message was that if you had to bet on the bugs, okay, or bet on the drugs, all right, as to who was going to win out, okay, you always wanted to put your dime on the bugs, okay, because bugs, meaning bacteria or viruses or whatever, are able to mutate, okay. And remember that with a virus, if a virus has a goal, okay, it's a little far of a stretch on that, but like the sort of purpose of a virus is to stay alive and to take over your cell machinery to keep itself alive and reproduce more and more viruses, okay? So the longer a virus is out, without being treated or without being eradicated, the more it is likely to mutate. Okay. And I think that one of the things that we know, well, a couple of little side points. One is that we have seen so much less in the way of colds and flu this year. Okay. That's really nice because there's a considerable mortality associated with influenza. Okay. But we're not seeing that this year for two reasons. One is that people are wearing masks. They're not spreading it. And the other thing is that it seems that there were many more people who got the influenza vaccine this year. So when it goes down the road and we're asking, well, what's going to happen, a year from now or 5 years or 10 years from now? Nobody really knows that. But this is where I would say, trust the fact that the bugs are going to mutate. Trust the fact that if we as people trust on herd immunity, I think it's immoral. I really do. I think that, when I was doing a lot of vaccines in our clinic for little kids, I used to deliver a ton of babies. And so we did all of those little kid vaccines. And we would have some parents who didn't believe in getting vaccines for their kids. Well, what they were doing is they were counting on herd immunity to protect their own children. I always thought that was a little smarmy, okay? I don't think that that's really a morally correct thing if you rely on other people able to take whatever perceived risk there might be to protect your kid. So anyway, I'm going to stop again. I'm sorry, I do get tangential.
It's okay.
It's okay.
But that,
You know what I did? Rico, really quick, let me just correct. I did have a chance to think about that, and it was the Johnson & Johnson vaccine that actually had that tough strain. So it's actually a better vaccine in the sense of it's been exposed to these mutations. And Linda, don't you think one of the reasons for the flu, and I have twin daughters and they're 7 in first grade, and none of us have been sick because they're not in school. So
that's a good thought.
I think that's probably one of the biggest things too. So even when they go back, we're understanding that, there's all these barriers now. Less kids in the school, alternate schedules. So I think we're really learning. And it seems kind of, if you think about it, you would go to school or work when you had a cold and you'd pass it to everybody and nobody cared. And it seemed just kind of barbaric thinking about it now, like, just call in sick because I have a cold or the flu. And now don't come in if you've got with the flu.
Don't even think of it, really.
Right?
Yeah. The other message that I think was really driven home, and I thought it was really helpful, was that message of don't touch your face, okay? If you get a viral particle on your hands or whatever from touching that doorknob that can house a virus for 4 days, okay? And then you touch your eyes or you touch your nose or your mouth, that's how you can inoculate, okay? So there was a lot of counseling that said don't touch your face. So think of what we've learned. I mean, we've learned how viruses spread. We've learned how vulnerable we are. We learned the conditions that make us more vulnerable, to getting a virus. And we've learned about social distancing. And just from experience, we've learned a lot about anxiety and depression because we as a people have not been able to do the things that have self-treated. Okay. So the movies that we went to, or the things that we would do to get together with friends, not so much. Okay. And it's going to be nice to get back to those, but those are things that have helped us in so many ways.
For sure.
I think if I can bring up one thing really quick, Michael, I'm thinking about this past year, and like Dr. Gromko said before, there's a lot of anxiety and depression. And, Zoom meetings are great. I can see your face, but I haven't seen you in person, Michael, in months.
Right.
So as a provider, it's a little difficult. Like I can see people, but I can't touch them. I can't watch them. I can't see how they're feeling, if that makes sense. So I'm missing out on that doing telehealth stuff now. But I feel like we just need to continue having these discussions. Even if we've got that Zoom fatigue, we need to keep doing this to make sure that we keep ourselves sane and keep ourselves in the community and keep ourselves alive, knowing that there are people there that are in the same boat with us who can virtually hug us and virtually hold on to us and drag us through it.
So true. Yeah, I know so many people, like, they're just so over all this whole thing. And I think our community is probably suffering more than many, just because we tend to be loners anyway. And we don't always want to have all that social contact, but when we want it, just like we are human beings, and we need to be loved and touched and all those other things. So it's been really hard. And I know that, like, for example, all the therapists at Borrego are pretty much booked solid. This has been a financial boon, unfortunately, for the therapy community. It also, in just when you're talking about the kids in school and stuff, like, I've been super healthy this year because I haven't had a cold. I haven't been around people to get things. Have you noticed, and again, it's kind of away from the vaccine, but have you noticed changes in your practices of, like, you spending all of your time on COVID and nobody's coming to you with other stuff? Well, I know Dr. Schine, you're always doing hormones, and Dr. Gromko as well, but other healthcare issues, especially Dr. Gromko as a family physician.
Right.
Dr. Gromko, are you back? Are you in office?
Yes. So yeah, we're in office.
Right.
And we actually haven't not been in office. Okay, we've been doing a lot of our phone medicine has been happening in office. We have been doing, our aesthetic portion, like our hair removal, which is surgical prep, for heaven's sakes. We've been doing that, but we have very, very specific rules about how we're going about that. But over the last month, I'm going to say about a month, we've been starting to see more people in office. And, it's such a very good point, Michael, that you raised, because one of the things that we're seeing is that people aren't doing their maintenance, care. Okay.
Mm.
I mean, there are not very many people who need an excuse not to get a colonoscopy. Let's be fair. But
Right.
COVID, I mean, how could you possibly do that? And
Right.
actually, there was a time when the gastroenterologists were not doing them at all. So you could validly put off your colonoscopy, but it's time to get back now. We're seeing people getting back for their preventative maintenance. Okay, you get your mammograms, get your colonoscopies, and whatever maintenance. And
Uh-oh. Oh no. Hopefully she'll come back.
Oh, lost for a second. She'll come back.
She'll
Yeah,
be
my
back.
internet's been a little bit choppy too. Well, and
Mine too.
just to continue to speak with what Dr. Gromko was saying, there she is.
Hmm.
Do you want to finish your thought, Patrick? Then we can go back
Sure.
to
So part of this is I have been telemedicine for a year, and so I've had a historically low no-show rate. So I see primarily trans. About 95% of my patient population is trans. So the ability to do a video visit from home, to be able to have those kind of frank discussions in an area that's safe for folks most of the time, and I think that's really helped during this. But one of the things I also kind of have seen and heard from our pediatricians are, kids are not getting in for the vaccines. Adults, when we're looking at, over the age of 50, when we start doing our older preventative maintenance stuff, we're not getting the shingles vax, we're not getting that stuff out because of this delay. And so now I think there will be definitely a backlog of this happening. And to Dr. Gromko, we do have providers in office, so we have several offices located everywhere. And a lot of us folks have been working telehealth, building up that practice as well. So I think we're all eventually due to go back in the office eventually. But again, our organization is so thoughtful about making sure that our family members are safe as well. If there's anybody with risk in the family, get yourself vaccinated before you come in. Looking at taking care of each other before we start to get back out there into full force again.
Yeah.
And Dr. Gromko, you were in the middle of a thought before your video went out. Did you want to
Sorry.
Do you remember what you were saying?
No.
I don't either.
Hint, please. I don't know. Sorry.
It's okay. Another thing I wanted to bring up about, while we've all been sitting around, they jokingly, we used to talk about the freshman 20 or the freshman 15 when you put on your first year of college and you put on weight. I think there's a lot of concern about people who have put on some weight because they haven't been active and getting out and doing their usual workouts or even just walking around. I mean, my Fitbit screams at me every day saying, you sucker. Like, what are you've got me all confused here. I thought you were trying to be healthy. And you're getting in maybe 2,000 steps a day at the best, right? What's that long-term impact going to have, do you think?
Well, there's a huge impact for that. I think we're all joking about the COVID-19, get it? And certainly, a number of us, myself included, have put on some weight, and it's so frustrating. And what I think part of that is like when I'm normally seeing patients the way that I do, I'm up and down and moving, all the time. And when you're just sitting at your phone, you're not doing any of that. So it's very simple to gain weight. Plus, you get into therapeutic eating. One of my friends was saying, hey, the world's coming to an end. Why not go for the Doritos? So, well, it doesn't seem to be coming to an end. So I think we've got to keep up with it. So.
Yeah, I know. Pollo Loco, which is a kind of a sort of semi-healthy fast food chain in California, one of their commercials around the Super Bowl was something to the effect of, so this is the special for the time that's about to come when you can no longer wear elastic waistbands.
Yeah.
Right? Because they push their healthy chicken because it's all roasted and not fried. And,
oh dear.
Anyway, so I thought that was clever. So we got a couple more questions, and we'll probably wrap it up here pretty quickly. But so going back to the vaccine, since that's why we're here, is there any reason that we should choose one vaccine over the other if we have the option? Is one
I can't.
than the other?
I can't think of any. I mean, there's been no deaths reported by the CDC from anybody getting this vaccine. And I mean, again, it's really availability. In some places, you might have a choice between all three or all four or all five as we come along.
Yeah.
It's just a matter of just getting them.
Anecdotally, I have heard that people are getting the little reaction that I got, you know, just the muscle aching and the fatigue. That I'm hearing that anecdotally more with Moderna than I am with Pfizer. But, you know, like I said, it's such a no big deal. You know, a little aching, and sometimes it is severe aching, but you know, it's so much better than the infection.
Yeah.
But I would always say for folks that have questions about, you know, should I get the vaccine or should I get one over the others, to ask their healthcare provider, because there may be underlying circumstances that Dr. Gromko and myself don't know about, of course.
Right.
And so, you know, transplant patients or, you know, things like that. I don't want to even go into that realm because it's not my specialty to advise on that.
Yeah. Are all the vaccines equally good at reducing asymptomatic transmission?
I don't know the answer to that. Does anybody else know?
I don't think we know the answer to that yet. They're still looking at that. From the last thing that I read, I believe on Friday, was that we don't know. So we're still looking and doing studies and trying to find out about any of those folks that are asymptomatic but may be spreaders. And if you get the vaccine, you're not spreading anything because you don't have the virus. But if you do get the vaccine and then you get the virus, but you're asymptomatic because of it, because the vaccine did what it was supposed to do, we don't know yet what that looks like. And again, when we think about it, that could be the cause of mutations. You know, as we're all going out there asymptomatically spreading stuff, the virus is going to get smart and start to mutate against the vaccines that we have.
Right. So
that's why we still recommend those precautions.
Exactly. I was just going to say the same thing. Yeah. So if you get your vaccine, you still need to practice social distancing, keep washing your hands, keep wearing your mask, stay in your bubble. Although there was something last week that came out, and don't quote me on the details, something about the CDC now said it's safe that we can gather in small groups of mixed bubbles. But does anybody know the details behind that one?
I think it's if you're vaccinated and it's been 2 weeks since your vaccine, I believe.
Yep.
Yeah, that's all I know about that. I'm sorry.
Okay.
Right. It's groups of 6, 2 weeks after vaccination. Yep. If you at 2 weeks after whatever vaccine you got, then you're considered protected. And right now it's groups of 6 or smaller.
Okay.
That you don't have to wear a mask. But if the 6 of you are standing around outside at a concert, you still want to wear a mask because, of course, you're being surrounded by dozens of other folks whose vaccination status is unknown.
Exactly. So is there anything else that we need to know or talk about, or other questions that the two of you have thought about that you may not know the answer to, but you just want to put it out there?
Yeah.
I think for me, really quick, is there is that website. So if people want to know if they're eligible for vaccination, and my gosh, I just had it on my screen and now it's gone. It's the My Turn. I believe it's myturn.gov or myturn.com. Let me see if I can look that up really quickly. But that's how you can know that you can get on the list and you can contact your provider and you know that you're eligible or ready for that vaccine.
I had a comment. I think I mentioned this the other day, but the comment about a friend of mine who had another friend in Montana was asked at the vaccine site for their what is your gender, your assigned gender at birth, okay? And and that person was really afraid. I mean, they were really afraid that that information was going to be taken and misused. There's no reason, for example, why a person must know whether or not a person was a, you know, I hate the terminology, but whether one was assigned a male or assigned female, there's no difference in the immunization itself. Okay. And, you know, language, oh my Lord. I mean, in the 20 plus years that I've been working in the trans community, language is one of the most difficult things because it changes every day and people get deeply offended by a faux pas in that area. So there's no reason why that a person would have to have that data as far as, you know, what your gender identity might be or what your birth gender might be. It's not something that would be important. So anyway, so this person, I think that the take-home message here was that this person who had the concern about it was thinking about not getting the vaccine. Okay, so if that's a barrier, I think that that's really unfortunate.
My recommendation would just be to refuse to answer that question if you're not
Exactly.
comfortable with it. Yeah.
Right. Well, and to think about it, like we had discussed this, you know, they use the right terminology when they ask the question, but the totally wrong
Yeah.
scenario to ask it in. For this vaccine, there is no reason anybody needs to know anything like that.
Right. I guess the only counter argument to that is, you know, like at Borrego, we try to make sure we always respect everyone's identity. So we do gather that data pretty much anytime we have people, you know, register for care. So, you know, if you're getting it in context with the care that you're getting, like there really isn't a reason that they would have to know for the vaccine, but maybe they are trying to just make sure that their records are up to date, you know, or something like that. So I think it's fair to ask what they're going to use that information for.
Absolutely.
But I would not let it prevent me from getting the vaccine.
Right.
You know, I would just say, you know, I'd rather just not answer that question and please give me my shot. Let me go.
And again, they may be charging your insurance because while the vaccine is free, the agencies have the ability to charge your insurance for it if you are insured. And they may just be asking questions to make sure that everything matches legally. But that should be a really upfront discussion about that.
That reminds me, access to the vaccines. We know that, you know, not everybody has a car and not everybody is able to go once, let alone twice, to get a shot. Folks might not know this, but Lyft, the rideshare company, is offering free rides to anybody that needs a ride to get a vaccine. They'll take you to the clinic and they'll bring you back, which I thought was incredibly generous of them. And it's a national program. I checked to make sure it wasn't just California. So if you need a ride to get your shot, just you know, if you can do apps on your phone, I mean, you might, if you don't have a car, chances are you might not have a smartphone either. But ask a friend to help, and the friend can send you the lift. I actually read that as well. So if you don't have a smartphone, if you know somebody that does, ask them to send you a lift. And there's instructions on the Lyft website on how all that happens. So if they aren't sure, they can read about it. But yeah, so that's really super important. Anything else around access or shots are free. You don't have to pay anything. I've never heard of anybody having to pay for it. Right. Our government is absorbing most of that cost, I believe, which is very generous. I mean, well, it's their responsibility really because it's public health. So,
and I believe insurances are, if you're insured, they are providing transportation to and from for the shots, depending on how many times you need to go. Right. I do believe they cover that.
Yeah, I know in California, the Inland Empire Health Plan is definitely doing that. I would imagine most of them are. Okay, so to wrap up, any parting thoughts or advice or snide remarks?
Maybe to remember that we don't have control of everything. You know, that's, this is not our responsibility, okay? The pandemic is not. You know, how we respond to it, how we respond to, you know, to the advice that we're given and what we're seeing, I think is our responsibility. So, but we didn't cause it.
And I would say in this time of great stress is just to remember to take a deep breath when, as providers or patients or whoever and wherever, just take a deep breath and try to be kind as possible, because we're all struggling right now. We're all going through something. And we're all in this together, and we're just here to keep everybody safe, healthy, and happy.
And especially be kind to yourself.
Oh, good point.
You know, we all beat up on ourselves more than anything, and so this is not the time to do that. And just love yourself and love everybody around you, those that you can be around.
Yeah.
And we'll all get through this together, and all those platitudes. Yeah. So I want to thank both of you, Dr. Gromko, Dr. Schine. It's a pleasure to see you both. I see Dr. Schine fairly frequently on camera because we work for the same agency. Dr. Gromko, I haven't seen you in person for a few years now.
Wow, yeah.
So it's good to see you. Also, thank you to Lauren and to Jasmine, our ASM interpreters. I know we kind of buzzed through a lot of stuff really quickly, and they've done a remarkable job. They've become Traction's favorite interpreters, so we keep having them back.
All
Thank you
right.
so much. All right, and if anybody has any other questions, please feel free to post it on either the Traction or the Gender Justice League Facebook page, and we can send them on to the doctors and get answers for you, hopefully, as long as they're not too complicated and out of their scope of practice. They seem to be pretty knowledgeable, though. I think they didn't give themselves credit for as much as they do know, and I know they were concerned that they would come off as like, oh, just we don't know anything, you know. But they're very knowledgeable, and I trust both of them with my health from at certain times. So these are good folks. All right, thank you, everyone. Actually, we're ending right on time, so that worked out beautifully. And I know that Traction will have a couple other events coming up soon on next month. There may be something in between, but I know for sure that I'm doing one on April 22nd. We're going to do our second music show that's called Vibes. It's an all trans live music. The first one we had right after New Year's was fantastic. Our next show is going to feature Michelle Rockinghorse and the infamous and amazing, I just forgot his name, from the Clicks. Yes, my dear friend from the Clicks. He's a trans man. He was the Clicks was the first band that ever got so they already had a recording contract, and he basically transitioned on the job as a singer. And God, I'm so embarrassed. What's his name? Let It Go. Okay, I'm gonna let it go. But anyway, it's gonna be a great show, even though I don't know who's gonna be in it. It's gonna be April 22nd, probably starting around 5 or 6 in the evening Pacific time, because we don't want to keep the East Coasters up all night. But anyway, thanks again, and keep an eye out for Traction and for Gender Justice League things happening. Like our pages, join our mailing lists. Of course, we're both nonprofit organizations, so we love your donations. Keeps us afloat and keeps us being able to bring productions like this to you. Lucas Silveria, thank you. That's it. That's his name, Lucas. He's an amazing musician and a singer, and I'm so sorry I forgot his name. Shame on me. Anyway, he's going to be one of our spotlight performers. So with that, I will say goodnight for the 12th time, and we'll see you next time right here live. Thanks a lot, and have a great night.